Concern and fear. A patient hospitalized showing possible symptoms for the deadly Ebola virus right here in New York. Good evening. I'm Christine Johnson.
And I'm Maurice Dubois. The virus is spreading fast in West Africa, and now a patient is being tested at Mount Sinai Hospital. CBS 2's Tracee Carrasco is on the Upper East Side tonight with more on the Ebola scare.
The hospital says that patient was rushed into isolation for medical screenings. Now they must wait for test results to find out if that man has the Ebola virus.
And it was about 7 minutes from the time they hit the door to when they were in isolation room.
Doctors at Mount Sinai Hospital have been preparing for the Ebola virus, but this was no drill when a male patient arrived at the emergency room early Monday morning with a high fever and gastrointestinal problems. He alerted the staff that he had recently traveled to West Africa, where the deadly virus has been reported. Now in isolation, that patient is being tested to determine the cause of his symptoms.
In conjunction with the CDC, who's been guiding us on the testing protocol, we're sending specimens down to them, and we expect an answer hopefully in the next 24 to 48 hours.
We were certain that the patient did not pose any risk to other patients or to our staff or to visitors to Mount Sinai.
While doctors say the Ebola virus is not contracted through casual contact, visitors going into the hospital are still nervous.
The case, the man from Africa, and a lot of people travel to New York, of course, it's a melting pot. It's very possible.
And overseas, the Ebola outbreak is worsening. The World Health Organization says there are now 1,603 cases in West Africa. So far, 887 people have died. The United States is getting ready to send medical professionals to the region to help, while American doctor Kent Brantley, who contracted the disease in Liberia, is showing signs of improvement. He, along with another American medical aid worker with Ebola, have received doses of an experimental serum. Doctors at Mount Sinai believe that will not be the case here.
Odds are this is not Ebola. It's much more likely that it's a much more common condition.
It could be any number of illnesses, but doctors want to rule out the Ebola virus. Again, those test results should be ready within the next 24 to 48 hours. Reporting from the Upper East Side, Tracee Carrasco, CBS 2 News.
And more info now on Ebola. According to the Centers for Disease Control, it was first identified in Congo in 1976. Right now, there's no cure, and experimental vaccines have worked on animals, but it's unknown whether it will also work on humans.